Hi, the following is my presentation on the women's health experience for breast cancer. I interviewed patient A, who was a 34-year-old female who at the age of 31 was diagnosed with invasive lumbar carcinoma, also known as ILC. During an annual exam, her doctor felt a lump in her breast. A mammogram, ultrasound, and biopsy confirmed this diagnosis. Treatment options for ILC is a lumpectomy with radiation, a single mastectomy, or a bilateral mastectomy. Due to patient A's family history, she opted for a bilateral mastectomy with reconstruction. From the time she was diagnosed until the last surgery, it was about 6 months. She is continually monitored by medical professionals. She sees a breast surgeon annually. She receives an MRI every 3 years, and she also sees her oncologist on a biannual basis. About 2 years after her surgery, patient A discovered that there was a gene mutation link between ILC and gastric cancer. In 2015, patient A tested positive for the gene mutation, and she opted to have a gastroenterology. She had her stomach removed to eliminate her risk of getting stomach cancer. Her current health status is cancer-free. ILC is the second most common breast cancer in the United States. All ages are affected, but there are higher rates found in aging women. ILC is difficult to diagnose through just imaging alone, as it spreads like branch-like through the breast and can affect tissues and areas surrounding the tumor. Treatment is based on the size and the location of the tumor, and it can include, but is not limited to, a lumpectomy, a mastectomy, chemotherapy, radiation, hormonal therapy, or biological targeted therapy. Patient A did not have radiation due to she was low at risk for having metastasizing. And then, as mentioned before, there is a link between ILC and gastric cancer. Estrogen and progesterone are also risk factors for pre- and postmenopausal women to get this type of breast cancer. Lastly, I interviewed Elizabeth Bonagiovanni, this certified nurse practitioner at Leader Surgical Associates in York, Pennsylvania. She stated that the average patients she sees in her office are in their 50s, but they range from 30s all the way up to the 90s. Majority of the patients are female, although they have had male patients with breast cancer before. They provide medical care for patients with breast cancer, breast infection, and for patients that are positive for gene mutation but have not tested positive for cancer. They conduct clinical breast exams and in-office testing for cancer, and they also place orders for MRIs, ultrasounds, or various biopsies to confirm diagnosis. They collaborate with other healthcare professionals, which are coordinated through a nurse navigator, which each patient is assigned. Health insurance typically do cover most of their services, but the nurse navigator role will also function as financial assistance, and they also offer within the office a pantry for patients and families that are struggling financially. They can come to the office and they can get food from their pantry. Some of the challenges Liz experiences is speaking with patients and families about prognosis. It's very tiring and can be very emotionally draining when you have to convey to a family that the prognosis of the patient is not good. Some of the positive interactions that she has with the patients is the strengths of the patients. She said that their courage and their drive to continue living their life to the fullest really inspires her and makes it worthwhile. Liz also stressed the importance of health and wellness. This can help prevent certain cancers, and it also can help with treatment and to ensure that cancer does not reoccur into patients that are in remission. Attached to my discussion post, I have provided everyone in the class with a wellness brochure that Liz created for the patients at her office. So feel free to take a look at that. And if you have any questions, please let me know. Thank you.